so great to be here, and thank you so much for the wonderful introduction. So I am, as our colleagues mentioned, a professor at the Medical College of Wisconsin, and also the director of a program called the LANI program. It's focused on Latino, Asian, Native Hawaiian, Pacific Islander health, and I also run a health equity research scholars program there. I will tell you a little bit about myself because I feel that coming to Hawaii and Maui in particular, it's very important in terms of how we enter this space, and that will be a common theme that I'm going to outline today. I come to you as being born and raised in Hawaii. My whole life was spent here, and my first faculty position was actually at the University of Hawaii. I've had a long history of conducting research from a cultural-based perspective, and I tell people that I have been doing EDI work before EDI became an acronym. People seem to think that that's just a relatively recent idea, but our work focuses really on inclusive excellence, and I welcome anyone's perspective in this work. I will say one more thing about this, because these are 3 photos that mean a lot to me personally. Being born and raised in Hawaii, I never thought I was going to become a university professor. That was the farthest thing from my mind. I thought I was going to do my PhD, and then it was going to be it. But I got the research bug, and I just love the work that I'm doing. So this is a photo of me on the day that I became a full professor, and I'm not sure you understand how unusual it is to see a lay in the middle of the Midwest when it's snowing outside. People look at you really differently. The fact that I wear a flower to work almost every day is very unusual when it's snowing and you're wearing a ski mask on, or whatever, ski mask sometimes, and a hat. And then in the middle picture is when I received an award focused on my life's work as a distinguished professional career award for Latino health by the Latino Psychological Association. And this book here was published by the University of Hawaii Press a number of years ago. I wrote the chapter. It was the first chapter, something that was written focused on Hispanic health in Hawaii. So I'm going to be talking to you today. They say that you can only keep 7 things in your mind at once. So I'm going to challenge you today. I'm going to ask you to keep 10 things in mind. Okay? It's called Miller's Law. There's plus or minus, 2 probably in there. But I come to this with some experience that I'm going to share with you, as I said, across many different health studies, not just with Latinos. I have a strong interest also in Filipino health and broadly in populations that are here in Hawaii. I will start with my inspiration. How many of you know who this person is? Probably everybody that's in Hawaii. Thank you. This is Father Damien. He's a Saint Damien, actually, who has greatly influenced my entire life, so much so that I named my son Damien. Damien in Hawaii is Hawaiian is Kamiano, and he was the person that is known as the patron saint of incurable diseases and illnesses. He chose, and he actually begged his superiors to send him to Molokai to work with the lepers. Okay, so if you can imagine that he chose to, it was such a strong calling that, and I draw this parallel because it's very much like many of us felt when the Maui wildfires occurred, right? You couldn't help yourself. You had to go there. You had to serve. So in terms of St. Damien, he actually ended up succumbing to the illness, but again, in service and in terms of my inspiration, I present him to you. Okay, what I'm hoping to do in our short time here is to describe some recommendations for integrating and promoting EDI in research. I ask that you, if you are familiar with this work, if it sounds redundant, to think about it more deeply, to think about the intersectionality of this. I'm hoping that this presentation will tie many things together. And I'm hoping that you're going to walk away from this appreciating that when we talk about Native Hawaiians, when we talk about Asians or Vietnamese, that you do ask yourself, well, who are you talking about that within that subculture of groups? At the Medical College of Wisconsin, I am charged with, and I think about EDI. I will say every single day of my professional career, I've thought about Latino health and EDI. At the MCW, we're trying to integrate this in all the work that we do, and I really encourage you to think about how you can integrate EDI into your research. So I'm going to be giving you some 10 recommendations. Some of them are going to sound basic, but again, I ask you to think about them more deeply. As we enter into this space and with all registries, really to learn about the different cultures, races, and ethnic groups and the local groups in their history. You saw some of that this morning that was being displayed. I'm going to draw heavily on my work with Latinos. So also to show you, for example, knowing just the right terms to use, because these words mean different things. Knowing that even if you're talking about a certain ethnic group, particularly with Latinos, we are multiracial people. We come from many different races. Knowing also that although the United States is 18% Latino, many people don't understand the influence of Latino on the history in Hawaii, from the early Spanish influence in the early 1800s. And I could go on and on to the early Mexican migration to Hawaii, to the Puerto Rican migration. So these are my great-grandparents who came to Hawaii in the early 1900s. So again, it's understanding, as we saw this morning, about that Hawaiian influence and the history, how important that is. It's important for every culture. Sometimes we forget that when we're in Hawaii. We just think, oh, we're working with Koreans, let's just work with Koreans. And I say we need to take a step back and enter the space appropriately. These are my great-grandparents also on the right-hand side. My grandfather was a boxer. After or during even when he worked at Pearl Harbor, he was there at Pearl Harbor on the day that it was bombed. Subsequently, my grandparents worked at St. Teresa's School as janitors, and so I grew up just knowing them as janitors in the school. And today I honor them in terms of the work and their decision to come to Hawaii, so that I could be here standing before you. Again, about knowing the population, knowing that this is the most recent statistics, knowing that we are 10% of the population. Sometimes it's more or less depending on what year that we come in. These are also the latest statistics. There's a little bit of competition going on. Ruben can testify this as to who has a greater number of Puerto Ricans and Mexicans. Last year was Mexicans, they were slightly greater. Pardon me for Yes, and this is also, this is just people that entered answered the census questions, right? So again, about it's knowing the community and entering to the space. The second thing, and we'll go a little bit faster here, the second thing is, of course, engaging our indigenous, racial, and ethnic communities. So we can all do this. This is the only research that I know how to do is community-based participatory research. I will say that I have conducted a lot of clinic-based research, so I do that also from a patient-engaged perspective. And I honor also my community partners. And I say that if you're doing CBPR research, don't forget the people that helped you way in the beginning, because their influences it's influenced my entire 30-year career studying Latino health. And I come back to Hawaii in the past 3 years to reinvigorate our community advisory board. These are some of my partners on Oahu and Maui. Pictures of them, us having fun. Okay, the third thing, to learn about cultural worldviews, cultural values, and gender roles. The reason why I'm emphasizing this is because not all ethnic groups adhere to what would be traditionally their cultural values. So on a deep level, it's important to realize, this is what I study. I generally tend to study cultural variables that underlie race and ethnicity, and a very systematic, basic, I say, psychocultural research, where I'm investigating the role of acculturation and acculturative stress, which is the stress due to the acculturation process. It is not always stressful for people, but for some people it is. I study greatly the role of ethnic identity, and we sometimes get those two constructs confused, and so we'll talk about that in a second, in a few minutes. The reason I'm going to point out some Latino values, but a lot of these hold true also with Filipino values as well. I'm going to give you an example of why it's important to study this. So this is some data from my data collection in Chicago, looking at differences between Mexicans and Puerto Ricans. So right here, these are Z-scores. This is showing you that there is actually a difference in terms of Mexicans and Puerto Ricans, Puerto Ricans having higher levels of familismo and machismo, which is a culturally prescribed gender role for men. So it's important to understand that so that you know how to integrate that into your studies. So because I feel that probably most of the people here that are conducting registries or cohort studies, you're including race and ethnicity, right? That's like basic, right? And I'm encouraging us, let's take a step further, because we already know that we are beyond health disparities research, right? In terms of we know that there's racial disparities. We need to do that type of work, but we also need to move within that, and to look at the causal, not just environmental causes, but also structural causes, and also come down to the individual. We've been talking a lot about behavioral health issues. I'm very pleased that we're mentioning that as a board member for the Hawaii Psychological Association. I'm always encouraging us to make sure that we're partnering with our medical and health community. This is an example of why it's so important. Again, if you just say, oh, I'm looking at obesity among Native Hawaiian communities or among Asians, well, this is showing you, if we think about Latinos being 37% rate of obesity, but you can see here the vast differences within each ethnic group and gender, okay? Same thing with obesity. Again, with disparities in mental health. So I encourage you, come and talk to me, please. I beg you, if you're doing health research and you don't know what measures to use, I can help you with that or help connect you with the right people so that we are connecting in the right way. This is just showing you the importance of measuring not just major depressive disorder, but also depressive symptoms. In the past 2 weeks, showing a slightly higher rate for Hispanics compared to non-Hispanics. Okay, and anxiety as well is important to measure. Okay, so moving right along, everybody's able to keep the first 4 things in mind, okay, in your mind? Now we're gonna go to number 5, almost halfway there. So we talk about studying health disparities, health conditions, but these health risk behaviors are equally important to study. I put these up here because these are my favorite things to study here. Again, some of my data showing, again, differences, and we will hear from Dr. Le Marchard from the Cancer Center also about multi-ethnic data in terms of Latinos and probably other ethnic groups as well. But again, vast differences in diet and physical activity. I'll mention smoking here, and this is a really important slide here because how many of you know HCHS/SOUL? Okay, so this study is the Hispanic Community Health Study of Latinos. This is the largest study across the U.S. looking at Hispanics. It includes 16,000 individuals across 4 cities. Sadly, they did not include Hawaii, but I was a co-investigator on this study, and this is where a lot of the data from Latino health more recently comes through. This is showing you, and we have evidence. We heard yesterday, someone had mentioned, I think Pedro Haro, about the high rates of smoking among certain ethnic groups. This is paralleling that research. The reason why I do this research here in Hawaii is also to highlight the Latino health disparities. This is from my data, not in Hawaii, but this is showing you much higher rate of 46%. It's extremely alarming. Okay, so we talked about, again, health risk behaviors, health in general to investigate. This is where I want to take a little pause here and talk about within group differences. As I said, I was going to mention that. These are some within group differences. I love using Pam Hayes's model that's called the addressing framework, which you think about each alphabet reminding you of different things that you should pay attention to in your assessments. Come talk to me if you're interested. I love doing culture-based assessments, so if you're interested in measures, I encourage you to talk to me or point you to the right colleagues. I'm going to give you some examples of what, we all know what acculturation is. You've heard of that before, right? Acculturation is when you adapt the attitudes, norms, and expectancies of the host society. But the problem with this within group difference variable is that it's often measured just acculturation to like the main host society and not recognizing how important it is to be acculturating at the same time to the other society that you're, if it's Korean culture and American culture, both tend to be happening at the same time, right? And that's the construct of biculturalism. And that's awfully difficult, important, to investigate. So that's a within group variable. We often use acculturation as, years in the US as a proxy measure of acculturation. It pains me when I see that, but I also say, well, thank goodness they chose to do something, right? So if that's all the variable that you can investigate, sometimes that actually shows more differences in terms of years in the US. So it's important to measure that. Ethnic identity, I mentioned that earlier. Ethnic identity is your thoughts and feelings about your own ethnic group. So I can be highly acculturated, right? And I feel like I am highly acculturated, but I'm strongly ethnically identified as a Latina female. Whereas some of my family members are highly acculturated, but less ethnically identified. You have to measure both of them, I think. This is my recommendation anyway. It is an important within group difference variables. Immigration status. So a lot of my work involves thinking about immigration, and then what? And making sure that we're getting out policy briefs. So I've written two policy briefs with my colleagues in the Society of Behavioral Medicine, and this is about just basically undocumented immigrants and what happens to them when they go to the hospital. Going to the hospital or receiving medical care shouldn't be something that's delayed because they're fearing deportation. So again, recognizing the importance of that. That's all I will say for that. But just, again, we want to go beyond just health disparities, beyond just, we measured different races. Oh, another within group variable difference is sexual orientation. This is data from a number of years ago, so this is not my reports here, but they were looking, this is a beautiful slide illustrating the higher rates of obesity among lesbians, for example, compared to straight women. Two other ones, I will just pause here and say discrimination. I think Allison, I saw that on your slide of racism and discrimination. Wonderful. It's important to measure that as well because that is a very strong predictor of certain health issues. So is skin color. And skin color is almost the universally minimized variable in the literature. There's many, we love measuring skin color in some of our research. Skin color means something very different in Hawaii compared to the rest of the US. That's why I'm interested in collaborating with people who are also interested in this. Okay, moving right along, just three or four more recommendations. So this is focusing on language. We talked a little bit, I think, when some representatives, David, I believe from Kaiser was here, and talking about their role in terms of expanding healthcare. This is really, really critical. So understanding the impact of language. So this is, again, in our research studies, right? Usually you somehow make a decision as to how to give somebody, if you're going to give them an English version measure or another language, right? Somehow some sort of assessment is done. Now you can go full on and do a whole battery of tests. You can do shorter measures. My recommendation to you in terms of having an EDI focus is to have both available, because I cannot tell you how many times it's an interesting variable to measure when we have interviewed and all of a sudden somebody language switches, or you can get, anybody else is a healthcare provider, you probably have seen this in a clinical encounter where all of a sudden they don't want to speak that language anymore. Why is that? One of the reasons is that language preference can be affected by many different contexts. If they think that that you might, not you, but just that there might be some discrimination involved, they might not disclose that they want to speak that language. And then, of course, there's differences in terms of what you're interviewing them on. They might say, oh, I want to speak English, I want the English version language, but then depending on the measures you're giving them, they might switch in the middle of that. So want to have both available and measure that when that switch occurred. I do a lot of dichos and proverbs. Dichos are Spanish sayings and proverbs. I'm well known for this in terms of my curriculum that I teach and my interventions that are led actually by each level of dicho. The reason why I mention this is, let me see a show of hands of how many of you speak a different language other than English. Okay, lovely, love that. Okay, many people don't, and certainly Spanish is not a common language in Hawaii for people to have as a second language. I will say that there is literature to support this in terms of memorizing different Spanish dichos, sayings, or proverbs as a way of connecting with individuals. It works out really lovely. I do this with my students and wellness groups that I lead. So you can memorize these, and as long as you know the meaning behind it, then it is fantastic. That's all I'll say about language, but I could go on. I have a separate lecture that I can give on language. This is another one. So learning, it's not just that we need more interpreters, and let's get grounded here, right? That interpreters refer to the spoken language. Translation is written, right? Oftentimes we get that confused. I know sometimes my language switches up. I actually am not fluent in Spanish, despite the fact that, I have a Latino head every single day. I've taken many lessons as an adult, but it's just, I'm still very present tense in my Spanish language. So learning how to use interpreters, learning how to use correct translations is important. And for any of you who have done translations or are thinking of doing translations in your research, I'd be happy to share with you some of my work on how to do community participatory translations. It's very difficult to do, but it's 100% the right thing to do, and it will last you for years to come. So there's guidelines for how to do this translation work. Interpreters. So again, it's not just about, oh, we need more interpreters. We definitely need more interpreters, but we also need to know how to use the interpreters. How many of you have actually used interpreters in your work? Okay. Have you seen things go wrong, things that you question about, like, wait a minute, that's not exactly what I said, right? They went off on some way. So there are things that we can do, trainings that we can provide. Both the interpreters, thank you, both the interpreters and the person that they're representing. A few more things here as we wrap up. So to just ground us in engaging in cultural humility and paying attention to your thoughts, feelings, and behaviors. I say this as a researcher and a psychologist. If you work with underserved communities, and regardless of who you're working with, seek support. Right? Talk about how you're feeling about working with those individuals. And I say this because we can sometimes start to behave in stereotypical ways towards individuals, and that can be very dangerous. Again, cultural humility is this orientation that you're very much other oriented in terms of your relation to that cultural identity. It's a lifelong learning process. That's all I'm going to say about that, because I can talk more about that if there's questions. My final recommendation is to seek feedback about your personal cultural competence and cultural humility. So, cultural competence, as I mentioned, is a lifelong learning process. Um, One thing I will mention is that oftentimes I'm showing you skills here, right? I told you, oh, maybe do this, stay away from this. I'm sharing you skills and knowledge. And cultural competency, the definition is having the awareness, knowledge, and skills needed to work with different communities. But when we talk about awareness, you know what that awareness is? It's not so much awareness of the other group, right? It's awareness of yourself. And I will tell you that probably many professionals never get that type of training as to understanding yourself as a cultural being. I think only when that happens that you can truly begin to understand how other groups might feel. So I have, since I was at the University of Hawaii, and I wrote a K Award, as a career development award, and I said my goal to NCI was I want to become a culturally proficient health disparities researcher in cancer prevention and control. And till this day, I will say that even though that was, like, I don't know, 30 years ago, I don't know, 25 years ago, um, I'm still on that mission. While I feel comfortable with certain ethnic groups, other groups, I still know that I'm still on that path. So I go to somebody on a regular basis to seek feedback and guidance, not just in terms of cultural experts, but there's ways to measure this also by questionnaires. All right, so I've taken you around the block. Here's my 10 recommendations. I know it's really tiny here, but again, there could be easily 20 recommendations. Again, just an emphasis on the grounding and culture. I'm happy to talk about that when we have our last session, because there are systematic ways, even though I focus my presentation on how to integrate DEI into research, right? All our registries. It's a separate aspect also. It's related about how to integrate culture from every single aspect of what you're doing with research. I'm happy to talk about that. I will say participate, involve, and give back. One of the things, as you know, research takes so long to do. That's why we just love the MauiWES study in terms of just putting everything on the web, making things accessible. In my research, what we do on a regular basis is brochures and information that's culturally tailored and targeted. We have brochures on smoking and Latinos, physical activity, on obesity, and they're bilingual. It looks like it's for them. And that's what they said they wanted. So I will end with that. I think I did good timing, 24 minutes. Thank you.